The hospital bag. Do I bring one suitcase or multiple? I don't want to start off on the wrong foot with the nurses. They see me coming through the elevator with like 6 bags. I've worn the same thing since last Tuesday. They're gonna have to pry these leggings off me. Do I need to bring my own snacks? Does the bag have to be under 50 pounds? Where do you even put all the stuff? Is it like packing for a vacation? What do I wear leaving the hospital? Should I match the baby? I mean, we'll both be crying, so that's enough matching, right? This is no vacation. What if the baby comes while I'm peeing here at the house? No one's gonna want to see that birth story. At least I don't have to worry about bringing all those bags upstairs. So I can't give birth in an Uber. I'm already at like 3 stars. How many people are really in the room with you? Doula, midwife. Okay, they can come if they fit in one of the suitcases. Mother-in-law. Wait, who's gonna bring their kids? There's gotta be like an occupancy limit. What do you really need to bring to the hospital?
Yeah, this is a great question because I do, get this from patients all the time because they want to bring like 7 suitcases worth of stuff. Um, Really not necessary, but I definitely tell patients to bring, the essentials. So comfortable clothing. They can bring their own, gowns. Although the hospital does provide gowns for women who are laboring and for postpartum use. Patients can also bring their own nursing pillows for after delivery. Um, I like for patients to bring their own toiletries. They do get provided toiletries, in the hospital. But sometimes patients just want to have their own kind of personal touch of what they use every day. I also think it's really nice to have a going home outfit for mom, to look beautiful after having, a human, but also for the baby, just because, of course, those personal, pictures and photographers that come to the room, it's just really nice to have that outfit. You don't really have to bring like wipes or diapers or even onesies. The hospital does provide that for patients, which is really nice. But some patients also may want to bring their own bottles or pacifiers or formula, just depending on if they're breastfeeding or formula feeding. So I think that's really up to kind of what the patient wants to bring. Also, say if patients want to bring their own breast pump, they're breastfeeding, they can bring that too. As we do have lactation consultants that are in the hospital at Women's, they also can help with setting up a breast pump before patients go home.
So has any of that changed since COVID?
Initially, they were not allowing for patients to go in and out of the hospital just to kind of minimize the traffic throughout the hospital. And so my, recommendations is always to kind of have a smaller labor bag and leave, bigger items in the car and just make one trip to get that out of the car, maybe once, the patient has delivered.
Any differences in terms of who can come into the room with you?
So right now, they are allowing one significant other, so it's usually a spouse or parents, and then also a doula.
And speaking of doula, so how do people decide on who they're going to have really help?
We'll counsel about that every trimester so that we have a plan in place. I always suggest that patients look into doulas, and we have great companies and doulas in Houston, and we live in the world's largest medical center, so we have all of these resources at our fingertips, which is great. Obviously, I think it's great to have a significant other in the room as well, as long as they don't get sick or are squeamish with the medical procedures. But I think that's a personal choice that a patient is going to have to make, but they should definitely discuss that with their obstetrician throughout their pregnancy.
And so how early do we need to actually pack the hospital bag to go to the hospital?
So I usually counsel patients between like 35 and 36 weeks. One, because that's a great time where you're seeing your obstetrician more frequently because you're getting closer to just seeing them once a week. And so, you can pack that bag, you can leave it in the car. And like I said, if things change or you have questions, at least you're seeing your physician once a week. And so you can modify that bag as needed. And so I think that's a great time. And then obviously when you're term at 37 weeks, you may need to use that bag at any moment. So, I think having it packed about a week beforehand is great.
If your husband is coming with you, does he need to have a bag packed early too?
Yeah, so I also counsel to have a bag for the significant other. And usually what I, suggest is it doesn't have to be a huge bag, but you do want, him to bring, his own clothes, underwear, toiletries, toothbrush, And then something to keep himself busy, because obviously while the mom is in labor, or especially for the first baby, it could be hours or days. And so, you want to make sure that they bring their books or magazines, a computer, just to make sure that they also have a good experience throughout the labor process as well.
It does take a lot longer than what you see in the movies sometimes.
It's a lot different than the movies.
So what advice would you give a first-time mom that's about to deliver, heading to the hospital?
I definitely always, counsel patients to make sure they have an open and honest communication pathway to their physician. So that way, if they have any questions or if they feel they're in labor, that they have, a number that they can call, even if it's after hours, to discuss kind of symptoms that they're having. So that way they can be directed to go to the hospital. We also at Women's Hospital have a maternal assessment center, which is basically like an OB/ER. And so they can be assessed by the wonderful triage nurses that we have there as well. I always tell patients there's no wrong questions or answers, and don't be afraid to ask. And especially, like I said, if there's anything that they're worried about in terms of labor or decreased fetal movement, those questions need to be called in at 24 hours a day if you have them. And also just tell patients just to relax as much as possible. I know it's exciting, especially if you're having your first baby, if you're starting to have some signs of labor, but just to be patient and to listen to your body and listen to your baby as well. So my name is Dr. LaTosha Steele. I attended the University of Notre Dame for undergrad and graduated with a degree, dual degrees in psychology and also pre-professional studies with a focus of course, becoming a physician. I also ran track for Notre Dame, so definitely was, in my fast days. And then went on to attend medical school at University of Kansas School of Medicine in Kansas City, and graduated in 2009. I definitely had an interest in women's healthcare, and so I pursued a residency at the University of Texas Health Science Center here in Houston, Texas. And it was great to come back because I'm originally from Houston, but hadn't gotten to live back in Houston for a while. And I graduated in 2013. After I finished residency, I did practice in a private practice in Northern Virginia near DC for 4 years. Met my husband, who's a retired Army captain, and then we decided to move back to Houston. And so definitely have been in Houston since 2017. And have been, I've definitely loved my experiences here in private practice. And currently I'm on staff at Women's Hospital Texas, and working at a great facility for women's healthcare and taking care of the best patients and working with the best staff.